Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about a common tendonitis that I'll see in the ankle area, referred to as a tibialis posterior tendonitis. But before I begin, please hit that subscribe button below. So going back to the tibialis anterior tendonitis, essentially this is a muscle that's responsible for plantar flexion, which is basically when we point the toes in the ankle area, and inversion. Inversion is when we bring the foot inwards. So this particular muscle is essentially responsible or contracts during these particular motions. So for certain individuals, if there's an overuse of this movement, or if this muscle is having to perhaps compensate for weaknesses in other areas, whether it's your calf, your gastroc muscle, or your soleus, what can happen then as a result of that is this muscle gets overused. There can be some repetitive strain, so to speak, and then the tendon connects muscle to bone, can then become inflamed, and it can become quite painful with this condition to weight bear, to walk, to do any sort of positions that involve pointing the toes or going inwards, and it can become quite debilitating. So from a physiotherapy standpoint, what we want to do initially is to actually have the patient stop those activities that are provoking symptoms. So again, this might be some of these weight-bearing specific positions, because typically what will happen is there'll be somewhat of a vicious cycle in which this tendon becomes irritated. So we want to promote actually some form of non-weight-bearing movement in order to reduce pain and help in terms of some of this swelling. So things like ankle pumps or getting on a bike can be appropriate for this without any resistance. From there, what we'd want to do essentially is work towards strengthening the different muscles that help to support this muscle and stabilize the ankle. And then from there, we'd actually want to return to weight-bearing functional exercises with the support, as I said, of all these other muscles that help to support the muscle. Doing this should provide the support required so that it doesn't become this vicious cycle, as I said, of that tendon becoming irritated and inflamed. If you have any specific questions or concerns, feel free to leave a comment below, and have a great day. Take care.